It is 9:30, everybody. Thank you very much. Thank you. I'd like to call the meeting of the Human Services Committee to order. Karen, please call the roll.
Chair Swarzy,
Here.
Member Cahill. Here. Member Garcia.
Here.
Member Desart.
Here.
Member Galassi.
Here.
Member LaPlante.
Here.
Okay, thank you for being here. And thank you to our other board members who are here who are not part of this committee. We appreciate you being here for our presentation today. Do we have any public comment?
No public comment.
Okay. Do any of our committee members have any comments they'd like to make at this point? Okay, seeing none. I am going to introduce from the Northern Illinois Food Bank, the Executive Director, Julie Yurko is here to give us a presentation. Also in attendance is Hester Burry from the food bank as well. And Julie, I'll turn it over to you. She's gonna make a presentation on the money that we have given to the Northern Illinois Food Bank Produce Program that we've been running now for about 3 years, close to 3 years. She's going to talk about the impacts of the money that we've given them, the need that's still out there, and it'll be open for questions too. So thank you. Come on up.
We have some copies because some of the print is pretty small. So I don't know that I have enough.
We'll pass them. Go ahead.
Oh, okay. Thank you. Thank you so much.
Again, good morning. Thank you. Can everybody?
Yes, I stand up.
Okay, I
Come up here.
don't want to be weird, but I'll be weird. Thank you for having Hester and me here today. We appreciate it. We are so very grateful for the funding, for the foresight, for the care that DuPage County Board has shown to Northern Illinois Food Bank and our network here in DuPage County. We are tremendously grateful for that. We do have a summary here for you of what we've been able to accomplish together over the past 2 to 3 years. But I'd also be curious before I start 2 things. How long do I have?
As much time as you
As
need.
much, oh my
Yes.
goodness. All right, buckle up. No. So as much time as we need. But second, is there anything you're really interested in learning today? Something that you were hoping to hear from Hester and me? Lynn?
Where are the best places that we need to focus our attention to have the highest impact and most effective and efficient way to get food in people's mouths?
Okay, very good. That's places to have impact. Yes.
Over the last couple of years, we've heard positive and negative comments about the freshness of the food in the pantries, and I'd like to know more about that and how we're fixing that problem.
Absolutely.
I just wanted to know what the numbers are in terms of what you're seeing in terms of the food insecure now, and how they've risen. I know they've risen. I just wanted to know what the numbers are.
Sure. Okay, very good. We will be sure to hit on all of those. On the first page, we have a driver over there.
Craig.
Craig? Is that Craig? Very good.
You can point, or you can say next slide.
Point or hey you, okay. You'll see that, and this is showing you total impact over the course of the program, which started in October of 22. It's over $4 million that has been awarded, and you can see on here how that was broken down, with the vast majority of it going to fresh produce. You can also see that we've used those dollars in order to purchase over 4.6 million pounds of fresh produce that's been distributed out to the network. We've also purchased some personal care items, which are so important to our neighbors, primarily because they cannot use SNAP benefits to purchase much of that. And then there are some administration funds for the food bank for us to not only purchase, but bring in and then get back out the food and the items that are given to us. So relatively impactful, I would say, right? That's a pretty good ROI for the program. On the next slide is one of our first eye charts for you. And this is showing all of the agencies that are participating in the program. As some of you know, we had all of the townships at the start of the program. We now have only 3. 3 have chosen to use funding in different ways. This is showing the total impact, and this is through December. Is that correct, Hester? This is through December of this year. And you can see that 11 of our agencies are receiving over 3/4 of the amount of food. And so these are the highest impact in terms of neighbors served and pounds distributed across the network, which has been very common. I've been with the food bank almost 16 years, very common that we have these very strong organizations that are kind of leading the effort in the county. I will say, to answer your question, Lynn, it's very, very impactful for those organizations because they are doing so much. We also map out DuPage County, we map out all of our 13 counties. And we know areas that are underserved or priority communities for us. The good news in DuPage County is those are very few, but the one that we focus most on is the upper northeast section of the county, you know, Bensonville, Wooddale up there. And we're seeing that even more with some of the challenges with the new administration. On the next slide, you're going to see the food. You have probably heard not only about some freshness challenges we had, but also about the variety. And what we've tried to do, right, we always focus on the hard 7 at the food bank, which includes potatoes, onions, apples, carrots, anything that has a very, very long shelf life. And you'll see that 43% of what we distributed is potatoes, onions, and apples. And we have heard feedback from our agencies sometimes like, okay, enough, let's shake it up a little bit. We're doing that for cost. We're doing that for locality, but we're also doing that for freshness. And so we did, within, gosh, I guess that was the first about year of the program, there were some instances where we either received product and we held it too long, or received it and it wasn't the highest quality. And so what we have done is we have looked at our whole process and how we can speed that up, and have worked to make sure that the produce is much fresher. And that's what we're hearing back. We haven't had complaints in the last year and a half about the freshness of the product. But that was tackled, I'd say, that summer of 22. Yeah.
Right.
So, we love all the variety and we try and go after the variety, but again, we're balancing that quantity, quality, desirability. On the next slide. This is need. This is need, and this is specifically for DuPage County. And so what you're seeing here is from July of 21 till January of 25, the number of neighbors that are coming to the food bank programs and agencies. Duplicated visits. So we're not looking at unique individuals. We're looking at how many times someone's crossing over the threshold to say that they need help. And the reason we went back so far is because I think it's fascinating that during COVID, we were welcoming 60,000 people to our network because we had such strong federal benefits going out, right? If you think about unemployment and rent abatement and everything else that was happening, child tax credit was happening. So we did see a huge spike when COVID first hit, and then it went right back down when all the federal benefits kicked in. Once we hit September of 21, that's when we started to see some of those being pulled back, unemployment and then child tax credit. And you can see how that starts inching up. Then you see inflation. That's what's happening in May of 22, March, May of 22. You're seeing all of a sudden you see that kick up of inflation and you see how that keeps rising. And then you see another kick up in March and May of 23, and that's when SNAP benefits went from the pre-pandemic allotment to the typical allotment of SNAP. And so you see a kick up and then you see it still climbing. We know that, yeah.
Can I ask another question to add
Yeah.
on to the first one?
Yeah.
With your best educated guess, I know you don't have a crystal ball, but what are you anticipating the needs to be and how steep of a climb? Well, I don't want to put words in your mouth, but if you can give us some approximation, because we have to understand as a board, the task before us, especially because it's going to impact where else we are spending our money or not.
Yes. Yeah, and so that's why we're so grateful. This is a link to feed system. So if you hear from the agencies ever around client tracking or link to feed, this is the data that we now have. We don't have this from 10 years ago. We have it, but we had it for COVID and we're able to see that direct impact. And so the things that we're watching at the food bank, our board is watching in terms of demand is the first is there fear? Are we seeing any fear? And we only have right now, November, December, January data. We're going to be getting February data in another couple of weeks. We looked at the ethnicity of the folks that are coming to us. We did look at unique individuals coming to us. And of the unique individuals coming to us, 45% of them are Hispanic or Latinx. And so we consider that the population that might exhibit some fear. We are not seeing a change of that in November, December, and January. Right now, fear is not impacting. That would have demand go down. And folks are afraid to come to us.
Sure.
But we're not seeing that yet. But then again, I only had through January and there were, 11 days in January when that fear may have kicked in. Then we're looking at this data And we're saying, what happens with tariffs and inflation? Last time it was an additional 80 to 100,000 visits across our network. We expect to see something like that happen again. 42% of the households across our 13 counties live under the living wage. 42% of our households. That's 500,000 households across the 13 counties. I don't have memorized DuPage. I can find it for you if you want it. That inflation is going to hit those households because we all know food insecurity is about not having enough financial resources. So what we're seeing with tariffs, I think will impact us. And I think that could grow us as a total by another, I would say 65 to 85,000 visits a month. They're also looking at SNAP benefits. They're looking at SNAP benefits without getting too geeky on some of the way that they value SNAP benefits. One of the things the Biden administration did was they looked at not only the inflationary costs of the food in the Thrifty Food Plan, they also looked at the quality of food and the plan. And so they, on average, they increased the amount that someone was going to get by about 20%. That is something that is under study right now. That is one of the key areas, the largest area they're looking to cut is to cut SNAP benefits, which would be another 20%. We believe that that would hit us even harder, probably at least 80,000 more visits. But it's hard to say. So we're kind of, one of my board members, many of our board members have encouraged us, stay the course, don't back down, keep doing what you're doing. And that's what we're going to do. And they said, even if you see all these things blowing up over here, let's stay the course. And if we can do COVID as a food bank network, we can do this new administration. Right?
No, I beg to differ.
You beg to differ.
Yeah, I
Okay.
do. I think those are to use a food compare analogy,
Yeah.
apples and oranges.
Okay.
So I think they're going to be affecting different populations in different ways.
Mm-hmm.
COVID definitely impacted those with less resources more heavily, right?
Mm-hmm.
And vaccine availability,
Yeah.
but really it was across, germs don't know anything about
Right.
anyone, right?
Yeah.
They're just going to infect as they do.
Mhm.
These cuts and these programs are very, very specifically targeted towards certain groups.
Mhm.
So it'd almost be like having a biological virus. It's
Targeting a certain group. And I do appreciate that. I do appreciate that. And I guess what I was saying was as a food bank,
Right.
right? Like we're going to try and find everything we can do to keep moving forward and do this work. I 100% agree that this is going to disproportionately impact the population that we serve. And that is going to cause, I think, a lot of stress on our system.
That's my only point is
Yeah.
that we have to be, I think, more mindful and more very, very, very focused on the money that we are giving for organizations like yours.
Yes, and I will say, and I was sharing this with Greg, that right now of the money that the food bank receives from the federal government, which it's all being passed through the state, right? Of that money, we do expect to see through the LFPA, the Local Farm Purchasing Agreement Program, and the Farm to Food Bank Program, which is funding that the state allocates. We do expect that to go away. It is frozen right now. It will impact our budget this year. Our budget ends June 30th, but not as significantly as it will next year. And so that is a big fear for us. And for that's 30% of our federal funding. That's 30% of our federal funding. That's gonna go away. 30% of our federal. Yeah.
Go ahead, Sue.
So, but if that federal funding comes through the state, then I hope that the state will make that up.
That would be great.
I mean, come on, how can he not do that?
Yeah.
All right, second, administration, your administration fees, is that salaries? What is that 200,780? Is that salaries under the funds awarded?
So we use that to cover the total costs of ordering, handling, and distributing the food. So some of it is salaries.
Okay,
Most of it is salaries, but some of it is also all the operational costs. So if you think about forklifts and trucks and gas, all of that is included in it.
okay, but you have a significant amount of volunteers at the food bank, don't you?
We do, and so
Okay.
the produce that we bring in that we process is all done by volunteers.
Okay,
But the actual ordering and distribution, the storing within the food
how
bank.
many employees are there at the food bank?
There's 170.
Wow, okay. Second,
And they serve 13 counties. not
right,
just
so
us.
this is just our county allocation. Second question, you said under participating food pantries, only 3 townships in DuPage are you feed. What townships are those?
Oh, they're on it's, Milton, Wayne, and Lyle are participating in the program.
York is on here too.
Yeah, York is.
York and Addison
That's what I'm saying,
and
why not
Bloomingdale.
Addison?
We serve them, we are partners with them. They're not participating in the program currently.
They opted out.
So they
Okay, I
did at the
know that,
beginning and then
but
they
that
opted.
is the key area you're talking about. That's the northeast. That's Addison Township up there.
And that was their decision.
Member Garcia has a comment.
Yeah, in regards to Addison, I know that we worked hard with them to try to get them to take the food. There was some concerns. And their food pantries, I believe, only open 2 hours, I believe.
Every other week, I believe, on a
Every other
Tuesday
week
morning.
now. So I mean, they're not open enough to help the people. So they're going to the outreach house. That's where they're going, the people from Addison. So unfortunately, which is now Addison's even moving a little further away from them because they're going.
I'm
down
gonna
just-
help
And I,
you with them.
Elmer Shortfield also.
Member Cahill, I've spoken with Supervisor Revelletti
Yes.
multiple times on this,
Yeah.
Right.
even as recent as about a month ago.
Yeah.
And they just do not want to participate.
I didn't see what the downside is. It's crazy.
That's,
Okay.
I shared my thoughts with them that were
Okay.
similar to your comments, yes. You didn't say it like that.
I didn't say crazy. I just said, what's the downside? You said crazy. Somebody
No,
said.
Anyway.
I didn't say it.
Anyway, let's have
Yeah.
Julie finish her presentation, then we can get back to the questions. So.
Yeah, on the next slide, I believe are the comments. And so we did reach out and we asked, and I'll allow you to read the comments from the agencies that are participating in the program. Highly, highly, highly supportive of the program. Comments about how impactful it is, the quality of the food, having produce, and how impactful it is allowed. And so I do believe that the agencies are highly, highly supportive of that. It's quite a gift. I don't have another county. Kane? There were other counties who go through.
We do have our funding from.
But not at this level.
Yeah.
Yeah, I mean, it's very impactful.
And I appreciate the fact that she included comments from various pantries around the county, so not specifically to one district.
Any other questions I can answer?
Yeah,
Oh, there's two, I'm
one
sorry.
more- One more.
Couple more comments. And I think the last one is around the future funding. And so we do, should it be approved, the additional $1 million, we estimate that we will be able to provide 1.6 million pounds of fruits and vegetables. I don't think you need a dollar down there. That's correct.
Sorry.
It's actually 1.6 million pounds of food, of fresh fruits and vegetables. And we, on average, right now, we're spending about $100,000 a month. And so we could spread that out over the course of a year. So it'd be a little bit less every month, or we could, keep it at the current level for 9 to 10 more months. That would be past June of this year.
When you do get some more data, right, like even January numbers or, right, that's what you're.
February numbers.
February numbers. Can you please keep us informed so that, I think personally, I would, as a board member and as a member of this committee, I would like monthly updates because I think things are going to be changing that rapidly. And with the danger looming of Social Security checks being possibly cut, that might happen within 30 to 90 days. We might see really catastrophic impacts. So I think right now, I keep saying this, but this is an all hands on deck moment. And for our work here at the county board, this is why we're here.
Yep.
So I personally would really appreciate monthly updates of numbers so we can see where the trend is going. And if it's unexpected, right? More than 30%, more than that kind of thing, we're gonna have to be able to react and respond and pivot very quickly.
Happy to provide it.
Thank you.
Absolutely. Absolutely.
Thank you, member. More questions?
One
by
last,
member Cahill?
how much are you asking for us to contribute this year?
Well, and I'll respond to that. So in Chair Conroy's 2025 budget, if you recall, she earmarked $500,000 for specifically food. We also have close to $600,000 in our food budget that was earmarked in 2024. So we basically have just a little over $1 million. And so, and it's earmarked for food and, you know, there's certainly other options, but I think the biggest bang for the buck and doing the most good is going through the Northern Illinois Food Bank. So,
I
yeah,
agree, totally.
thank you.
And $500,000 seems like a lot, but it's only 5 months according to Julie. And so did the other counties contribute as much as DuPage County contributes?
No, but we do receive ARPA funding from Will, Kane, McHenry, and in the past we have Lake.
Well, this isn't gonna be ARPA funding anymore. We're out of ARPA funds.
Thank you. I'm sorry, but that's how I consider it. That's how we've gotten funding in
So
the
Hard.
those are the only county funds that we've received from other counties has been ARPA funding.
Okay.
And that will.
So 500,000 for 2025 is not ARPA, but the 600 that we have left from last year was ARPA.
Right, but I'm just
And
saying that
DuPage
this is
County is
only
Moving
5
forward,
months.
yes,
Right, moving
yes,
forward.
yes.
Yeah, and prior to this funding, DuPage County used to earmark about 150,000. Do I have that right? Right,
Say it again,
150,000 a year to us
for administrative
food.
costs?
for food
For food.
total.
I'm not sure what the question is.
Oh, just in
Two
the,
thousand and nine until COVID.
Oh, prior to
COVID.
In the
It was about
DuPage County
150,000.
budget.
Yeah,
For
yeah.
food.
So my bigger question is if DuPage County can, you know, see the food bank through 5 months, do the other contributing counties, can they, you know, pick up the other 7 months?
Not for DuPage.
Yeah, they're not gonna pay for
DuPage.
Just goes
to use
just-
that money.
our-
yeah,
money
we're only
just
using
feeds us.
this funding in
I'm sorry,
DuPage.
Julie?
Yeah,
I'm sorry, Julie was talking.
yeah, we're only using this funding in DuPage
In
County.
DuPage County.
Yeah.
Thank you so much.
Just
Thank you.
only
Thank you.
DuPage, yeah.
And so, just to be clear, what I'm gonna be asking this committee for is to use $1 million. The current money that we've been giving them runs out either at the beginning or end of June.
End of June.
End of June. So we're feeding people through the end of June. My suggestion would be to contribute $1 million to continue this program, which I think I heard would be about 10 months with the entire $1 million. So it would go through roughly April of 2026.
I support that.
So, member Glassy.
I
Sorry.
think the answer to this is yes, but I just want to be specific. So if we do the $1 million from DuPage County, is all $1 million of that going to DuPage County?
Yes.
Okay, and that's being like tracked, or, I mean, I just want to make sure that it's our citizens that are getting that.
100%.
It's-
Okay.
And the list, that list of recipients they're all in DuPage County.
Okay,
So,
yeah, okay. And then my second question is, you mentioned the potential fear factor affecting the amount of people that are coming to you. What is your process when people come to you? Do you ask, you know, what information do you ask, I guess is my question.
Sure. So, the true answer is it depends based on the program you're coming to. If you're coming to one of our food pantries, you're going to be asked to provide first name, last name. You're gonna be asked to verify your zip code. You might be asked for your address, and then they might ask you some other demographic questions. You know, how many people in the household, ethnicity. Someone can come and say they'd like to visit us anonymously. If they do that, they're not going to get federal food, but they would receive this.
Okay.
Member Garcia.
Well, 2 questions. One to follow up on what Member Galassi was asking. Have you had anybody there asking about any of the clients? Is that information you can give out?
So we have been studying Know Your Rights, and we've been talking with lawyers about what data we would be forced to share. We would need to have a warrant to share any information.
Signed by a
with.
judge, correct?
Signed by a judge.
Correct.
We asked our agencies a week and a half ago if anyone has had ICE or any federal officials come on their premises, and they have not.
That's good news. Okay.
That's very good news.
Second question, I know we've been talking about produce here, but my concern is I'm not sure, is that the best use? Is that, you see that's what people are in need of now, or do you think there is a greater need for other food that they might be?
The highest in
requiring?
demand products are produce, protein, and dairy.
Okay.
This was also created together with the agencies, and I believe it was the agencies who were very, very interested in the fresh produce.
Yeah,
my recollection
originally,
correct?
or
Yeah,
the current, to my recollection, 2024 through 2025, we did include some proteins. Are we including any proteins in this right now?
No
Okay,
No, nothing.
okay.
In the first couple of years, we did do diapers, detergent, toilet paper and wipes.
Okay.
But then really the agencies the response we got was that they would prefer more fresh produce.
And we would always be willing to bring the agencies together and say, this has been renewed. You know, let's do a plus delta, what's going well, what's not going well, how much you want.
What they're really in need of now,
Yeah,
because I think
yeah.
things might have changed a little bit, but I'm not sure.
Any other questions? Andrew's up. Sorry,
Thank you, Chair
Member Holman,
Swarzy.
sorry.
I guess to kind of go off what Member LaPlante was saying too about like the fear looming of the coming months and the following year as, SNAP benefits may, decrease and whatnot from federal funding. What is your outlook on, because I know with some federal agencies being here in the state of Illinois, and I know that people are afraid to not only leave their home to go to food pantries and to food closets, or clothing closets like PRC or any other areas that provide that. Do you see a decrease because of the perception that, we all don't know what's gonna, come down the pipeline, but do you see just from the news or perception that it's decreasing those numbers because of that fear? And, going forward, again, to what Member LaPlante was saying, having those monthly reports really could be beneficial so that we could forecast where that need is and how we can restructure how we as a county and a county board can operate and function to, serve the needs of, DuPage County residents the best.
Yeah, I do think we're gonna see some kind of shift. Whether it's an increase in anonymous visits or an increase in different distribution methods. So we have mobile markets. We don't have a lot. 90% of the food in DuPage County goes out through an agency, not a food bank program. In other counties where we don't have a strong agency network, it's very different. It can be 30, 40% food bank programs. But we do have mobile markets. We do have an online food pantry, and we will lean into those. That's one of our strategies should we have to respond, because those offer more anonymity. And we don't collect specific data through those programs. But this food would not go to those programs. Those are supported through the food bank private plan.
Thank you.
Real quick, am I gonna lose any committee members here anytime soon? Just
Transportation too.
2 of you? Okay, so we'll still have a quorum. Okay. Member Rutledge.
Thank you, Chair. So during the worst of COVID with CARES Act money, I directed $3,500 to each township for diverse feminine care products. Now they're coming back and saying, man, we're out. So as part of our member initiative, we are looking at giving money to our food pantries for those items. So note to the other county board members, it's a little bit of money that'll go a long way in that respect.
And Member Kate.
One last question. So dairy, you have cottage cheese and yogurt are both protein items. You're providing that?
So we have a relationship with Prairie Farms where we offer milk that the food bank will subsidize. And then they can also order all sorts of dairy, cheese, cottage cheese, eggs, etc. Yes.
Okay, I'm gonna shut down questions. Thank you very much for all your questions to this committees, and thank you so much for being
Appreciate
here.
it. No,
Yes, thank-
appreciate it.
Thank you, Hester.
We'll get you monthly reports.
Thank you so much.
Yeah.
Maybe a meeting.
Say it
I'd love
again?
to have a meeting about that.
Yeah, and we'll talk.
Okay, you know how to get us.
Yes, so,
Thank you.
all right.
Thank you all very much.
Thank you.
Okay, we're gonna jump onto our agenda.
Thanks for coming.
I'll take a motion to approve 25-0646, the
So
Human
moved.
Services Committee regular
Second.
meeting, February 18, 2025. Any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. On to DuPage Care Center. I'll take a motion to approve HSP 1325. Recommendation for the approval of a contract purchase order issued to Staff Healthcare Services for supplemental nursing staffing services for the Care Center for the period April 13, 2025 through April 12, 2026, for a total contract
Second.
amount not to exceed $650,000. Thank you. We have a motion, a second. Any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion on HSP 1425, recommendation for the approval of a contract purchase order issued to Bright Star Care of Central DuPage for supplemental nursing staffing services for the Care Center for the period April 13, 2025 through April 12, 2026, for a total contract not to exceed $330,000. Any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve HSP 1525, recommendation for the approval of a contract purchase order issued to RCM Healthcare Services for supplemental nursing staffing services for the Care Center
So moved.
for the period April 13, 2025 through April 12, 2026, for a total contract amount not to exceed $100,000. Did we get a second? I'm sorry.
Second.
Thank you. Any discussion? All in favor, say aye.
Aye.
Opposed? Thank you. I'll take a motion to combine consent items 8A, 8B, 8C, and 8D.
So moved. Second.
All in favor, say aye.
Aye.
Opposed? Thank you. Take a motion to approve 250647 pulmonary exchange. This purchase order is decreasing in the amount of $16,390 and closing due to purchase order expiring. Item 250648 Cimbria Rehab Inc. This purchase order is decreasing in the amount of $624,041.75 and closing due to purchase order expiring. Item 250649 Cisco Food. This purchase order is decreasing the amount of $97,882.54 and closing due to purchase order expiring. Item 250650 Valdez Supply. This purchase order is decreasing the amount of $51,437.88 and closing due to purchase order expiring.
So moved. Second.
Thank you. Any discussion? All in favor, say aye.
Aye.
Opposed? All right, thank you. On to DuPage Care Center update. Janelle is on Zoom there. Thank you, Janelle.
Sorry, I'm still recovering, so, I wanted to talk about the agency. I know we have some new members and I wanted to touch on that a little bit. So, we keep agency contracts, with 3 vendors. And that, as you've seen in the past, whoever's providing us the most staff, so we might move those dollars between those 3 buckets. So you can see our contracts total about $1 million. In 2024, our budget for agency was $990,000. Our actual was $780,000. So we were about $200,000 under budget for agency. We're also paying less in bonuses for our own staff to pick up shifts. So we're seeing some decrease there. Our 2025 budget for agency is $895,000, so down from 2024. So I just wanted to give you that because that's a lot of money, and contract is different than budget. Comparable, but a little different. So any questions on that? Because I know it's, yes.
So what is the percentage of contract versus full-time staff?
I
Roughly.
don't have an actual percentage. So we run around 23 CNAs on the day shift, for example, and that's where our agency is coming from, is CNAs, and about 23 on PM shift. And about 5 of those now are agency on day shift, a little
Okay.
less on PMs. It used to be 12, 18. And when we get construction done and we reopen units, we're gonna have to find, staff to fill those new units, remodeled units that are reopened. And we struggle, of course, with retirements. We have a long tenure of staff, and especially in our CNAs. When you look at that CNA tenure program where the state is supporting us to pay CNAs with 6 or more years experience as a CNA, 99% of our CNAs have 6 or more years experience. So we have a workforce that's aging here at the Care Center. We did have a good uptick in hiring. We continue to see that in dining services and housekeeping. I would say nursing is still occurring, but maybe at a little slower rate right now.
Thank you. Any other questions for Janelle?
I have a couple other things.
Oh,
So we do
hold
have-
on, remember to
Oh,
start
sorry.
that question.
Go ahead.
Hi, Janelle. I just wanted you to clarify, you said nursing is still occurring, and I wasn't sure whether it's still occurring as in the aging.
We're still having
staff.
hires. No, we're still
Hiring
getting nursing
people, or-
hires, but it ebbs and flows, and right now it's a little less than it has been.
So it's flowing.
It's flowing, but less than it was.
Thank you.
Thank you. Go ahead, Janelle. Thank you.
Yep, so we do have 1 unit on, we thought we were coming out of quarantine and we have 1 positive person today. So it's dwindling down, so that's always a good thing, but unfortunately 1 makes it linger a little longer. And then I wanted to let you know, we've been battling the whole 3 North construction completion. The architect waived the survey, and I keep telling you this. And so we're waiting for the clinical and getting that communication to occur between the two offices within the Department of Public Health has been a challenge. I finally received notification on Sunday that that communication did get submitted to the local office, so we should expect that survey anytime. It's unannounced. So once we have the clinical survey of 3 North, then that will open. 3 Center is going today to, or excuse me, this week, saying that it's 90% complete. So it's moving. It's just now we're getting caught up in some of that. It's great that they waived the survey, but then their process is broken, and it took how many weeks to get that to be communicated to the next office.
Okay, thank you very much. Any other questions for Janelle Chadwick? Thank you for all you do. We appreciate it.
Thank you. Thank you.
I don't believe, oh, Mary, you are here. Thank you. She is visiting us from Washington DC, where she spent the last weekend fighting
Feels like a year.
for
Yeah.
DuPage County. So go ahead, Mary. Thank you.
Yeah, hi, thank you. Yeah, I'm just wrapping up here at NACO. I'll be actually heading to the airport immediately after this, and then zooming in from the airport to the community development meeting in a little bit. It's been an interesting week. I've been here since Wednesday. We did some hill visits on Thursday with some committee staff for some of the more relevant committees to the work of my department. I would say sort of a mixed bag on lots of folks are really in the dark as to what comes next. And this is, I'll say it's both on the majority and the minority side. Still uncertain as to what will happen on the 14th with whether there will be a full year's continuing resolution or whether there will be, that whole budget reconciliation process will be done. So, but there's been a lot of good information sharing between my peers who manage the same funds that we do, just about what people are hearing from their local field offices, what instructions they're getting or lack of communication that they're getting. So all in all, I'd say it's been really helpful to just have an opportunity to kind of find out what's going on in other areas. Other than that, I don't have any significant updates.
Hey, any questions for Mary Keating? Mary, quick question for me. It sounds like the state of Illinois has not been able to access funds that have already been approved. Has there been any discussion on, I mean, it sounds like there's maybe 8 or 10 states that's affecting. Any discussion in Washington on that?
I've not heard any discussion here. We did get an instruction from the state to go ahead and request our second quarter CSBG and LIHEAP funds. They said that they've received those funds. So yeah, there seems to be a little disconnect between that letter that was sent, I think about a week ago, and what we're hearing. We've not had any difficulty. We've not had any difficulty drawing down funds that we receive through the state.
Oh, good.
Whether the state is having difficulty at the federal level, I can't answer that, but we've not been instructed to hold off.
Okay.
I will say, with the exception of, there's funding that came from the bipartisan infrastructure law that we've been instructed to hold off. And that's one of the funds for our weatherization program.
Okay, thank you.
Mhm.
Okay, do we have any old business from the membership? Yes?
Thank you. I just wanted to clarify what you said earlier, Jared, and that is that I think all of us want to support the food insecure. And you said you'd like this committee to commit to another $1 million. Is that the $500,000 in the budget, and then the $600,000 in surplus from last year, so that we still have $100,000 left over?
I think the answer is yes.
Where's the million coming from? is what I'm
So,
wondering.
oh, go ahead.
I just want to clarify because there was some, so where you have 600,000 in ARPA interest that has been reserved. And the chair and her budget that was approved by the board allocated another 500,000. So you have ARPA interest that doesn't have an expiration. And then you have 500,000 that absolutely has an expiration of the end of this year. Am I saying that correct? ARPA team?
All of it's from ARPA interest.
Wasn't there 500,000 out of the
You're
the
right
chair's
in the
budget.
breakdown of the two, but
Yeah.
they were both, one came from the chair, but,
It's all
All
our.
our
interest.
interest, okay.
Okay,
So no
all right, so I was
expiration date.
mistaken. So we, the 1,000,001 is all ARPA interest. So that is, you have that until you spend it. There's no deadline of that. So if you want to do a little bit this year, it'll still be there next year and
Gotcha.
a year
And
after.
that's where millions coming from.
Correct.
Perfect. I just want to clarify. Thank you.
Any other old business? Mary Catherine, any update on the small human services grant? The portal closes a month from today. And
we've got 9 applicants right now on the portal, and we've actually taken a lot of questions,
okay,
unlike
good.
last time around. So we have, we're gonna get something out probably to you at the end of the week, just being like, here's a recap of, where we clarified things. Here are the ones that are ineligible. So we're trying to, to do some of the work a little bit more upfront this year.
Okay.
So far, so good though.
Member
And
Desagne?
I just wanted to give credit where credit is due. Mary Catherine, a couple of other folks have, actually been in person to meet with some of my constituents to clarify questions and things. And I think that's awesome that I could just, email, I was gonna say call up, but email Mary Catherine and say, hey, these organizations want a meeting. And she was all over it. So thank you, thank you, thank you.
The entire finance team, thank you very much.
I
Member
would actually
Taylor.
piggyback back on Member Desart's comment. A few of the agencies from from our district, District 5, had shared the information with them about the Zoom webinar. And they watched that webinar and they found that incredibly informative. Thank you for doing that as done. So many of their questions were answered ahead of time. So thank you for that. And they did email me to let me know that that was very good.
Thank you. Well, I know everyone's in a hurry to get out of here, but I do want to chat real briefly about the presentation today. So we have just a little over $1 million. Now, there is the potential that money is going to be there and we don't have to spend it. But to me, the deadline is the end of June when our current food program runs out. And I did want to make clear that even though like a township like Addison isn't involved in this, they can still, anybody can come back into this. So if they choose that they want to, and we'll ask them. But, $1 million isn't a lot of money, especially when we started with $2.5 million going straight to the food bank. And then last year was $1.5 million. And now we're down to $1 million. And then you can see the need is getting bigger. So I personally would like to get this on the agenda for our next committee meeting. But I want to see if there's a consensus here to use the $1 million for
Yes.
food.
Yes.
Okay, okay, thank you.
With the caveat, though, I do think, Chair, that when we are making these kinds of decisions, we look at other decisions that are also being voted on in terms of allocation of funds, because we are in a whole new ballgame. We are. And I think we have to really quickly adjust. And so I'm all for this because this serves the people directly. We have to be very mindful of other programs and other allocations of funds that do not. Because I think that's just something that we can't just say, yes, full steam ahead without also saying yes to this means we might have to say no to other things. So we just have to be aware of the prioritization that we all have to do as a board.
Totally agree, totally understand. I will say this money is specifically earmarked for food.
Right.
And it can't, and so what are the other entities out there that we could give this to?
We just have to be like, to your point, that this is through June.
Yes,
So we have to save for a rainy day.
thank you.
Can I ask a couple clarification
Sure,
questions to make sure I have what the committee wants? So do you want the exact same program that you have right now, encapsulated in the agreement we bring forward? Do you, as a committee,
I think
want any
it's
changes?
I think it's an extension of the program that we're currently using.
And, I know that she rounded it to 100,000, but I don't think it's quite 100,000. Do you want to, if we can grab an extra month out of it, it's like $1,025,000. Are you guys okay with that for whatever we can? We will work, so our finance team will work with Northern Illinois Food Bank, primarily the same program. And if we can stretch another month out of it with a little bit more, we will bring that forward, okay?
Okay.
Do you have any questions that you need answered or direction you need?
No, just, last time around, we did allow for the protein and the dairy in the agreement, so.
And keep
I would
it
say
in there.
conversation. we'll keep that
Yeah,
in
yeah.
the same.
Gives them some
right?
flexibility, whether
Yeah.
they choose to use it or
If
not.
they choose, they
And-
can
and-
not.
And I will say this now, the work they do is, I mean, it is work and it is time consuming. And I think we have 1,090,000.
Slightly less than 1.1.
So,
093,899.
so
Give or take.
So I would like to talk to Mary Keating. In 2024, we included $200,000 for administrative costs, which we didn't include in 2022 or 2023. So my thought was get an idea from Mary Keating on how much of this $1,090,000 would be included in, and she's on whatever administrative fees, whether it's the 90,000 on top
Yeah,
of the million. for the
so just
food.
the history of the very first contract that we did, we gave them a flat $10,000, which was clearly not nearly enough for administration of the size of the contract. We then, and I don't have the numbers off the top of my head, but I believe in that second contract, we gave them a larger sum for the admin. And I want to say overall, it came out to, it averaged out to 6 or 7% administration. So, you know, that might be an appropriate, which is a very low administrative fee,
Yeah.
6%. So that might be an
Overall.
appropriate level.
Overall, they're at 5%, which, like you,
Okay.
is very, we agree,
So
is
that's
very
like
low.
50,000.
That lowest of what
Yeah.
we've done, you
Yeah.
know, for the ARPA grant at least.
Could I suggest maybe, I mean, because it's not timely, because we have a couple months before it gets done. It's a big enough number that I would suggest that Mary and the finance team and maybe Sheriff Swarzy meet with Northern Illinois Food Bank and they can negotiate the contract.
Okay.
And when there's a contract, if you guys are good with it, and then I'd like you to be part of it, kind of have the will of that, but over the next couple of weeks, we'll negotiate. And when we have, I mean, and it must include obviously some overhead, that you can be there when we
Okay.
talk to them. I think that makes sense.
And
Yeah, sure, vice chair, for sure.
And when that contract is ready, we'll move it forward. But the good thing is we have a couple months before this current one
Good.
expires.
Okay, everyone on board with that? Yes.
Yeah, I'm not the member of this committee, but my 2 cents. Someone who's raising a 16-year-old boy, I believe that protein and dairy are just such an important part of a lot of these families. I believe that we are in a time when a lot of things are uncertain, but I believe that food is the most basic necessity for any community, for any family. So the more we can support our families in their most basic need, the better it is for us. Chair.
We'll have that conversation with the food bank. Thank you. Okay, any other new business? Without objection, we are adjourned. Thank you, everybody.
Thank you.